1,
2,
3,
4,
5.
6.
You're sitting at the doctor's office for probably the umpteenth time, glancing at the same old pictures on the wall, reading the doctor's awards that are placed ever so neatly on the wall, and yet the suspense is killing you even though you know what the doctor is about to say. There are so many people out there with fatal diseases that the end of the line is imminent. Patients suffer, families suffer, and doctors suffer too. The debate over physician-assisted suicide or physician-assisted death, we'll call it PAD, is part of the process of improving care for all dying patients and their families. Doctors have a responsibility to address the suffering that persists despite their best efforts. What if their best efforts aren't enough? What if there is no solution and the only thing that is going to happen to this patient is excruciating physical pain and severe psychological damage? Who wants to experience that in their last days of life? Patients enduring pain and depression with terminal diseases should have the right to physician-assisted suicide to ease the already intolerable dying process. According to an article in a human rights magazine written by Kathy Liu, doctors were finding it so painful to tell terminally ill patients that not only were they going to die, but there was nothing they can do about it and they would have to suffer and let the disease take its course. The physicians did not have the right to help these patients kill themselves by terminal sedation. So these physicians and these 3 patients sued the state of New York for the right to die. If a person can refuse life-sustaining medical support and treatment, then why can't they have the right to PAD? Try to go with no pain, no suffering, and just a tad bit of dignity. This is a very complex and controversial issue, and the Supreme Court ruled that there is no constitutional right for a human to kill themselves. However, the Supreme Court left the door open for future deliberation and left the decision up to state governments. Euthanasia is illegal in all states of America. What is the difference between euthanasia and physician-assisted suicide? The difference is who administers the dose of medicine. With PAD, the doctor does the preparation as far as sanitizing the instruments, making sure that the patient is in the right type of environment, and also making sure that they have the right amount of medicine to make someone sleep forever. After the IV is administered, the doctor then takes the syringe and puts it in the IV and then gives the syringe to the patient. The patient then, at his or own pace and readiness, administers the drugs into the IV. Euthanasia is when a doctor or some sort of third party administers the drugs, so there is a difference. As mentioned before, euthanasia is illegal in all states of America, but according to an article relating to euthanasia on Wikipedia, PAD is legal in the states of Washington, Oregon, and Montana. When a patient is sick, they have the right to refuse dialysis, chemotherapy, and even life support. If they decide to continue with life support and then change their mind, they sometimes no longer have the right to pull the plug. Some feel that physicians are not trained in this area when they go to medical school to handle a situation like discussing PAD with the patient. They are incompetent, uneducated, inexperienced, and some will debate, sometimes dishonest. I think with the right documentation and proper consent and brief therapy with the patient and the family, they should have the right to choose whether they live or die. Whether death engulfs them while enduring pain, misery, and the thought of being a burden to their family, I think there is some dignity left for someone in their family in this situation and even closure. Religion and physician suicide is kind of another perspective. I think spiritual or religious people will feel the same about PAD as they do abortion. I think many people will fluctuate between what is acceptable when it comes to PAD. Catholics, on the other hand, strongly oppose physician-assisted suicide. If we can give medicine to help cure diseases, that is interfering with natural causes of sickness or death. Christians believe that because they oppose to euthanasia, they believe that life is given by God and that no one should interfere with the natural dying process. If we can give medicine to help cure disease that is interfering with the natural cause of sickness or death. Think about it from a religious standpoint. If someone is sick, that was God's path for that person. If we administer testing, medicine, and get diagnostics to treat this illness, isn't that, from a religious standpoint, interfering with God's plan? Well, this is from kind of the opposite end. Someone is suffering, their family is suffering, they sit and pray for a quick and painless death. However, they suffer beyond any doctor's relief. Why not relieve this person and their family and make the suffering stop if they choose to? To me, it's the exact same thing. Whether or not you are for or against this action, keep in mind the suffering and their families. If you have lost a loved one or know someone who has lost a loved one to an incurable or fatal disease, then you know how serious this is for the patient and their family. I would think every human on earth would have compassion for the people who are suffering from deadly diseases and intolerable pain, with their families in a detrimental state as well. After hearing what I have to say, I would hope that you could form your own decision on physician-assisted suicide for the people enduring agonizing pain and their families already grieving for them. Let us try to relieve some of this stress by giving them the right to a good death. I think the right to a good death should be a basic human right. I mean, whose life is it anyway?
Very good.
That's good.